Let me do the room. 360. Sun came out.
Sun came out, so we're gonna nail this one.
Okay, go for it, Terry.
Hi there, my name is Terry Dilly. I'm your student nurse taking care of you today. I'm gonna go ahead and do hand hygiene. I'm gonna go ahead and provide for privacy. Could you tell me your name and your date of birth?
Kate Lisk, 7/7/1980.
All right, and do you have any known allergies that I need to be aware of?
No.
And are you in a comfortable position?
Mm-hmm.
All right, I provided for privacy, did hand hygiene. I'm gonna go ahead and look at the provider orders. It looks like we're gonna do a neuro assessment. If you're okay, I'm gonna be checking over your head, your eyes, your nose, mouth, and check your lymph nodes.
Okay.
Any questions or concerns?
Nope.
All right. I did the hand hygiene. Okay, could you, any allergies?
No.
Okay. I'm gonna go ahead and cleanse my equipment. All right. All right, can you repeat after me? Blue sock bed.
Blue sock bed.
And could you tell me your name?
Kate.
The date,
3/3.
time,
3 o'clock.
and place.
Southwest Tech.
And why you're here?
For an assessment.
All right. And could you tell me the name of your first pet?
Copper.
Copper. All right. And could you tell me those 3 words that I told you earlier?
Blue sock bed.
All right. That's all great. Thank you. So at this time, I'm going to go ahead. I'm looking at your face. We are symmetrical. We got good color to your face. I'm going to go ahead and have you smile so that I can see your facial expression. That is good, nice, and symmetrical. And I'm going to go ahead and palpate your head, checking for tenderness and masses. Let me know if you tender anywhere.
Nope.
All right. So then we're going to go ahead and let me know when you feel this.
Yep. Mm-hmm.
Okay, the next thing I'm going to do is, just because it makes sense to me, I'm going to check your sinuses,
Okay.
your maxillary and frontal. All right, thank you. All right, so I checked your head for symmetry, color. That all looks good.
Okay.
All right, the next thing I'm going to do is move to your eyes. All right, I'm going to check for your eye leg. I'm going to have you close your eyes.
Okay.
Checking for edema, swelling, color, all looks good. Nothing noted there. I'm going to check your conjunctivitis, pull down your eyes. Checking for color, moisture, that all looks good. Looking straight at me, I'm checking your pupils for size and color, your irises, and your sclera. Checking once again for color, symmetry, deviations, or lesions. None noted there. So the next, I'm going to check your reaction. I'm going to go ahead, check, look straight ahead. Dilation, they retract and come, that looks good. The color. All right, the next thing I'm going to have you do is your reaction. Not reaction. I'm going to have you follow my hand in and out. That is your accommodation. All right, and then I'm going to do the cardinal. That looks good. And then, like you say, for advertisement, I'm going to have you read.
Leroy and Son blogging.
All right, thank you. That was good. All right, so I check your irises, your pupils, your cornea for color and clarity. That all looks good. I'm going to go ahead and palpate around your eyes. Let me know if anything feels tender. All right, that all looks good. So I checked for your conjunctivitis. I checked, that was good in color, moisture, checked for your edema in your eyes, palpated. The next thing we're gonna do is we're gonna go down to your nose. I'm checking for the size, the color, the symmetry of that. Okay, I'm gonna check for drainage. If you could lift up your nose, checking for the color, the polyps. That all looks good, nothing noted. I'm gonna go ahead and have you smell.
Lavender?
All right, that is good. I'm gonna palpate. Let me know if anything feels tender. All right, the next thing I'm gonna do is I'm gonna go down to your mouth. If you could say light, tight, dynamite.
Light, tight, dynamite.
Could you go ahead and checked, while you did that, I checked your lips for moisture, color, and symmetry. That's all there. I'm gonna have you go ahead and stick out your tongue. And the positioning of your tongue is straight, color is good, and moisture is noted. I'm gonna have you go ahead and move your fingers so I can see your inside of your cheek. Checking the mucus bolus, that is good. Check the other side, that is good. The color, moisture is noted. That is good. All right, I'm gonna have you put your tongue at the top of your mouth. Looking there, it is good in color, moisture. I'm gonna go ahead and just check your hard and soft palate. If you could open your mouth. Looking there, nice moisture. It is enclosed. If for an adult, I would normally put my finger up and checking the hard and soft with your index finger. A child, I would go ahead and use my pinky to feel that. I'm gonna go ahead and put my gloves on. And so at this time, I'm gonna take the tongue depressor and I would take this and stick it in her mouth and check, say ah. Okay, I noticed the uvula is mobile and your tonsils don't have any drainage, symmetrical, no swelling, and no exclude. Noted. Okay, and then I'm gonna have you stick, if for a gag reflex, I would take the tongue depressor, put it further back in your mouth, and have you do that. But we're not gonna. I don't feel like making you puke today. And then I'm gonna have you lift your lips up so I can see your gum lines. No bleeding, no retractions. That looks good. Gums look like good moisture, good color. So I checked your uvula, your tonsils, your hard and soft palate. I checked the gag reflex, which was important. And I had you say light, tight, dynamite. The tongue was straight, which was key for positioning. All right, the next thing we're gonna do is we'll move on to the ears. So for your ears, I'm looking for sermon, color, symmetry. I'm saying the word so much. Symmetrical, no drainage, pushing in on the trigger, folding forward, checking your mastoid. That is good. Okay. And the next thing I'm going to do is do the hearing test.
Let's go outside. The sun is shining.
All right, thank you. So I am going to have you go over and we're going to do your ears.
Okay.
And the things I'm going to be looking for in the ears, I am going to be looking for foreign objects, redness, swelling, and sermon. And so for an adult, it's up and back. For a child, it is down and back. And so what I'm going to do is look in here. And so what I'm looking for is to tympanic membrane, and for color, I'm seeing pearly white and gray. For characteristics, it is flat, not bulging. And so I'm going to go ahead and check this side. It's nice and pearly gray, and the tympanic membrane was flat and not bulging. All right, thank you very much. All right. So the characteristics that I was looking for before we went in was foreign objects, edema or swelling, redness, the serum. I think I got it. Because if it was a kid, I would look, I feel like I'm forgetting a word. The foreign object in the ear, the serum going around the ear because if it was infected, the redness, the color, you guys talked about the candle. All right. The next thing I'm going to have you do is I accidentally forgot to have you move your jaw back and forth for mobility. Awesome. That is great. And I did do the gag reflex. All right. And the next thing I'm going to do is move on to my wonderful lymph nodes. Okay, the pre-auricular, which is in front, posterior auricular is in the back, and the occipital. And so what we're going to do the tonsils, and then we're going to do the submandibular, the submental, and then what my wonderful classmates have taught me is cervical. So we're going to do posterior cervical, and then we're going to do deep cervical, so if you could turn, and then we're going to do the superficial cervical, which is right along here. And then we're going to do the Superman. So we're going to do the supervascular clavicle, which is right above the clavicle bone. So we'll make sure that we go all the way to the end.
Close to them.
Nope, it's good. So I think I got it. I had you move your head. I forgot to do the range and around. Okay, so if I got time left, I asked you time, place. I asked you about your dog. I did the lymph nodes. I did the gag reflex. Your eyes, I did the reading. I did the cardinal, which was a star. The ears, I did the drainage, the color, which was a major thing. The color, the pearly gray, the characteristics not bulging. I did the whisper test. I did the smile that you guys told me for stroke, so I did that. The tongue was straight. Okay, and one of the other items that I forgot to do is there anything I can get you while I'm here?
No, okay.
Okay, so then the next thing I'm going to do is bed is low, it's locked, call light, side table, no trip hazards. I will cleanse my equipment. And I asked you if there is anything you needed.
Right, yeah, I'm good.
And the most important thing is doing my hand hygiene when I leave. And any deviations I would document per facility protocol, and I will upload into OneNote. And I'm calling it.